This year's International AIDS Conference in Durban, South Africa, is the 13th global session on the disease. It's also the first to be held in Africa. That alone is significant, since it's believed that the HIV virus that causes AIDS first originated in Africa decades ago. And the continent is also where the disease has wreaked far and away the greatest human devastation.
The lifetime risk of dying from AIDS has become really incredibly high in several countries. It can be as high as 50% in countries like South Africa, Botswana, and Zimbabwe.
In fact, it's estimated that of the 34 million around the world who are infected with HIV, nearly 25 million are in Africa. That's equivalent to the number of Europeans killed by the bubonic plague in the 14th century. In South Africa alone, nearly 1 in 4 adults are infected, and a total of more than 4 million adults and children. And a new UNICEF report notes that in countries like South Africa, Lesotho, and Zimbabwe, 1 in 4 young women ages 15 to 24 are infected with HIV, as are 1 in 10 young men.
This epidemic in South Africa and around the world is out of control. And that the numbers are staggering, and that we all ought to be mobilizing to do more. And that means in the United States and other donor nations as well.
Amid that dawning reality, there were widespread hopes this week that South African President Thabo Mbeki would back off earlier statements. Those seemed to call into question whether HIV causes AIDS in Africa. But that didn't happen. Instead, in an opening address to the conference, he singled out poverty as the chief cause of AIDS.
It seemed to me that we could not blame everything on a single virus. It seemed to me also that every living African, whether in good or ill health, is prey to many enemies of health that would interact one upon the other in many ways within one human body.
As global AIDS experts worried that Mbeki's comments would slow efforts to attack the disease in South Africa, researchers at the conference unveiled several hopeful studies. One showed that treating pregnant African women with the drug AZT significantly reduced the risk that they would transmit the virus to their babies. However, if those women went on to breastfeed their infants, the risks of transmission rebounded. Researchers said that makes it more urgent than ever to find acceptable alternatives to breastfeeding among infected African women. Another study unveiled at the conference showed unexpectedly good results from treating small groups of HIV-infected Africans with combination drug therapies. Those are widely used in the U.S. and other developed countries. That's likely to increase pressure on international drug companies to slash prices on these drugs, or to give them away for free, as some companies have already done. One is Glaxo Wellcome, which produces AZT.
Glaxo Wellcome has been speaking to the South African government for the last 3.5 years, whereby we've been putting preferential prices on the table. When I'm talking preferential prices, I'm talking prices of our anti-AIDS drugs to reduce the costs by between 75% and 80% of the world average prices.
Apart from the staggering costs of drugs, World Health leaders say huge sums of money are needed for basic AIDS prevention and care in Africa and other developing nations.
What we now facing as a major challenge is that to mobilize new resources. They're highly inadequate. We estimate that Africa alone needs between $1.6 and $2.6 billion per year to contain this epidemic.